And here with us now, the Republican representative from Virginia and House Minority Whip, Congressman Eric Cantor. Congressman, good to have you with us this morning.
Good morning.
I want to get down to health care in Iran in just a second, but quickly, if you would, sir, your reaction to the news out of South Carolina yesterday with Governor Mark Sanford.
Well, look, I think the American people are right in assuming that their elected officials are to be held to a higher standard. Governor Sanford addressed that last night. He apologized. I think all of us need to sort of focus our thoughts and prayers on his family right now.
And we've done that. A lot of people talking about 2012, what this means for Republicans. Does this further damage the Republican Party at this moment?
You know, listen, neither party has a monopoly, unfortunately, on this kind of thing. And this will be covered, for a couple days in the news, I'm sure. But really what we ought to be doing is focusing on what you just focused on in the last segment, which is about this economy, because that's where people's focus is.
Representative Cantor, it's Dylan. I guess the one distinction is for political power, the Republican Party in recent years has utilized family values as a mechanism to accumulate power. They have represented themselves as that higher standard, and it's only for that reason, because I agree with you that this is an issue that plagues every side of the aisle. It doesn't matter what your political associations are. Infidelity and whatnot happens. It just happens. But do you feel that your party is more vulnerable to this type of behavior by virtue of the way the party's power was accumulated over the past 10 years?
Listen, Dylan, it's certainly not helpful. It's not helpful for either party to have to go through this kind of thing.
Of course.
But, look, I think going forward, what the Republican Party is focused on right now is the disconnect between what the Obama administration and Speaker Pelosi are promoting here in Washington and the reality on the ground for working families and small businesses. We're spending money at a clip faster than we've ever spent before, amassing debt more than we ever have before, while people across this country are out of a job. We just saw the jobless numbers. They continue to go up. Why aren't we focusing on trying to do something about this economy instead of priority one for Nancy Pelosi this week is imposing a huge national energy tax? There's just a huge disconnect. And I think as you see going forward to 2010 elections and 2012, a Republican Party that will be about trying to advocate our solutions to try and address the real concerns of the American people.
If you look at those concerns, specifically, again, I kind of ignore the healthcare polls because I feel like it doesn't, if I ask a question, I can get the answer that I want for a healthcare poll because everybody's in favor of it and no one wants to pay for it. What is your particular solution to that reality, which is the political attractiveness of giving healthcare away or creating a healthcare that's more accessible, which everybody wants on some level, and the inability to pay for it? How do you reconcile that?
Look, we've got to provide access to the kind of coverage, the basic coverage that people need. So we number one, I think, cannot have a government plan. You've seen the cost estimates. They're astronomical. The latest estimate that's being discussed here on the House plan is $3 trillion. That's after the $1.6 trillion estimate of the Senate plan. Obviously, this is crazy talk. We don't have that kind of money to spend. Where we've got to go, again, is to center any kind of solution on patients and their ability to choose their doctor and the kind of treatment they need. Secondly, we've got to make sure that we've got the flexibility. This country is based on, right now, an employer-based system. 70% of Americans get their health care through their employer. We need to provide the flexibility for small businesses and large to be able to provide the kind of coverage that they can at a less expensive way. And then also we've got to be mindful of the consequences. You don't want a government plan. You want to provide the ability for small businesses and individuals to access basic coverage, not through the government, because if you got the government doing it, you'll never have the kind of choice you need.
All right, Congressman Cantor.